Mistakes that did not have to happen. A new report shows more than 1 in 10 patients are harmed during their medical care, and more than half of those injuries could have been prevented. Jennifer Bellamy joins us now. Jennifer, what did researchers find, and what's the best way for people to protect themselves?
Well, Cheryl, this information published just this week comes from the British Medical Journal, and one of its authors says it shows the need for strategies to stop avoidable errors.
Medical mistakes, patients just looking for treatment not receiving the best care. A new study shows more than 1 in 10 were harmed during treatment, and 12% of those errors led to permanent disability or death. The results did have an international view, but its author says the takeaways still apply in the United States. A 2016 report from Johns Hopkins Medicine said more than 250,000 deaths per year in the U.S. were caused by medical errors. But it's not just deaths. The report found non-lethal harms that range in severity, most of them mild or moderate, as opposed to severe. Some related to drugs or other therapies, surgical procedures, healthcare infections, or problems from diagnoses. Experts say there's not a silver bullet or cure-all, but it will require a mix of patient and staff engagement, consistent management, and in some cases, technology. Hospitals across the country are working on ways to improve, like increased training, creating reporting hotlines and registries to compare practices and share ideas. But when possible, patients and their families should work to become their own advocates. The more people involved in or observing care, the better. And don't be afraid to ask questions or pause treatment to make sure you're comfortable and understand.
And another tip that experts recommend is to not be intimidated by a busy doctor or other medical staff. And tracking even the basics like hand washing and protective equipment being used can go a long way as well. They also suggest checklists. They say they're a good idea and can force us all to really pause and think about what's going on.
Jennifer, thank you.